I'm Dr. Michael Kotze from the Everett Clinic, and I'm an orthopedic surgeon, and I'm going to be talking to you about frozen shoulders. So when a patient with a frozen shoulder comes into the office to see me, the most common reason they come to see me is because they're complaining of pain in the shoulder. And the pain is usually localized either on the side of the shoulder, the middle of the shoulder, or even, curiously enough, radiating pain that goes all the way down to the middle of the shoulder and the middle of the arm. Some patients even say it's my arm that hurts, it's not really my shoulder. The most common reason that someone stops putting up with the pain and finally decides to come see me is because of night pain. And that's usually because their spouse is sick of them tossing and turning in the middle of the night. But frozen shoulder can really keep you up at night when it becomes severe. It also can keep you from combing your hair, tucking in your shirt, and the pain can even radiate to your neck or back around to your shoulder blade. Now, unfortunately, we still don't really know what the cause of frozen shoulder is. We do know there are some risk factors. The most common risk factor I see in the office is diabetes. That's by far the biggest risk factor, but there are some rare ones like heart disease and thyroid disorder and Parkinson's and shoulder fractures. Now, while we don't know the cause, we do know what really is going on here. And so if you look at this middle diagram here, you can see this here is the ball of the shoulder right here. And there's a lining, a capsule that goes around the joint here. And this lining has to be really flexible because when you move this arm all the way up so that this ball and the arm are going straight up in the air like this, this lining has to be able to stretch all the way over to here when you're raising your arm. If this lining doesn't stretch, then your shoulder will become stiff. And in fact, what happens is this lining becomes very thick. All of this area here becomes thick and inflamed, and this area right in here, the same thing, becomes very inflamed and causes the pain whenever you move the shoulder. And there are specific stages to this problem. The first stage is the inflammatory phase, and that is what causes most of the pain. And the shoulder gradually becomes stiff. In fact, most patients don't really even recognize that they've lost a lot of motion in their shoulder. But when you ask them, geez, can you reach behind your back? Can you move it as far as the other shoulder? And they look at both shoulders at the same time in the mirror, that's when you really notice it. Then there's a frozen phase, and that is where the pain isn't so bad, but the shoulder remains really stiff and frozen and doesn't move. And that can last for several months. And then finally there's the thawing phase where the shoulder starts to get the motion back. Now, the treatment for this problem is a daily stretching program. Hot packs to help you with the pain. It usually helps a lot when patients can't sleep at night. Put a hot pack on there beforehand and it makes a big difference. And the other thing we tend to like to do when the pain becomes severe enough is we like to think about doing a shoulder injection. And a shoulder injection is where we will put some medicine inside the joint here, and that will bathe the whole area here with a strong anti-inflammatory medicine, and that'll take away this inflammation, take away the pain that's caused by all the inflammation here. And patients are usually able to sleep better at night after these injections and make it easier to do the stretching. And 80% of patients improve with this type of treatment in 6 to 18 months. Now, in 20% of patients, when stretching and injections fail, surgery is something that can be considered to help with this. And what the surgery does is we do this arthroscopically. We go inside the shoulder and we tend to basically cut out this thickened, inflamed tissue here in several different places. You go in down below here and cut this out and basically take out all this inflamed tissue here and stretch the arm and manipulate the shoulder so that it stretches everything out and you get your motion back. And this surgery works rather well. It does involve therapy afterwards, and it does involve a few months of recovery afterwards, but it can definitely help patients who don't get better.